NCDs are the number one killer of people globally, accounting for 70% of premature and preventable deaths. 85% of those deaths are happening in low and middle income countries, and that burden is increasing. But we have an opportunity. We have an opportunity to really think through how we can support governments using data and evidence to implement policies that are really going to help reduce the burden of NCDs. Because if we know if we don't do that, already fragile health systems are going to crumble under that demand. The good news is we know what to do. It's health taxes. If we implement health taxes by increasing prices on harmful commodities like tobacco, sugary drinks, and alcohol, we can actually save 50 million lives in 50 years. But health taxes are actually a win-win-win proposition because we're not only going to reduce the future global burden of NCDs, we're going to create revenue that governments can use to actually support and finance programs for NCD care and prevention. And then that third win is about reducing current healthcare costs, because we know if we are not addressing these risk factors that are going to progress disease for people living with NCDs, that's just going to continue to burden the health system that right now is really not built up enough to address the growing demand. What we need to do is to be able to bring together folks who are working on this issue. So we don't have to duplicate, and replicate work in each country. We can actually share practices, share analysis, share models, share policy that works, and really accelerate progress, in this area.